to the voice box. And squamous cell carcinoma is the most common type of cancer to develop your throat, your voice box, your mouth, your tongue, etc. Okay. As with any cancer in existence, there are always three treatments that exist: surgery, radiation, and chemotherapy. For what we call head and neck cancer, it's located within the head and neck. Chemotherapy as a single agent is never considered curative, right? So that's unlike things like leukemia or lymphoma. You just get some IV medicine and it goes away. Unfortunately, that's not the case for head and neck cancer. Typically, our cancers require surgery.
Can I help you?
That was an accident.
Now you fix it.
So typically, these cancers require some other more aggressive form of treatment, usually surgery and radiation with or without chemotherapy. Now, a long time ago, before we had radiation, chemo, all that stuff, we only had one treatment for this problem, and it was surgery. It was surgery called a total laryngectomy, or complete removal of the voice box. Patients who've had
Your license, may I help you?
It's an accident. We can't turn her off.
It says the cord now. I'll be right there.
Was a surgical laryngectomy. Right? So you may have seen patients with it on commercials or PSAs. They're patients who have no voice box. They have a permanent hole where the trach is, and they use like an electronic voice box to speak. We've obviously come a long time since then. But obviously with the invention of radiation chemotherapy, many patients with voice box cancer can avoid a surgery to remove the voice box. However, there are still certain circumstances where surgery is still the best treatment to cure this problem. Because not only do we think about curing the cancer, we also have to think about functional outcomes after treatment's done. And what I mean by functional outcomes specifically is breathing and swallowing. Right? In terms of the degree of what your tumor is now, based on your CAT scan, the cancer has invaded into and through the cartilage of the voice box. If you feel your voice box where Adam's apple is, on the right half, that entire right side, there's cancer through and through the wall of the cartilage. When that happens, we already know chemoradiation is actually not a great option for cure. It's definitely not a great option for function after treatment is completed. This thing has grown so big now, obviously, it started encroaching on the opening of the windpipe, and you were literally breathing through a slit prior to the tracheostomy. And so, in my opinion, in this situation, the best way to treat this and give you the best outcome would actually be surgery up front, followed by radiation with or without chemotherapy. And here's why. So I tell patients, well, here's how a laryngectomy is performed, first of all. So if you envision your throat to be a funnel with two spouts that it drains into, right? The front half of the funnel is your voice box. The back half of the funnel is the swallowing portion of your throat. The front spout is the windpipe. The back spout is the esophagus. In fact, the windpipe and the esophagus is almost like a double-barrel shotgun. They're back to back. During a laryngectomy, the first thing we do is we transect or sever the windpipe and disconnect it from the voice box. We then sew that opening of the tube to the front of your neck. Right, so if you look in that hole, you're looking down to the lungs. The lungs are now completely separated from the mouth and the nose, and you breathe through the front of the neck. The difference between a laryngectomy and a tracheostomy is, for this procedure, all I did was cut a little slit in your windpipe and snuck a tube in. Instead, during a laryngectomy, we transect the entire cross-sectional area and sew it to the front of the neck. We do that for a couple reasons. Number one, it's a much bigger opening. Number two, it won't close on itself, because the edges will heal to the skin. We then take the larynx out, which is the front half of the pharynx, okay, send it to the lab. And now what we've got left is the back half of a funnel, draining into the esophagus. Now clearly, if we just left it like that, if you ate food, just spill out into your neck, so we can't do that. So during the surgery, we have to rebuild the throat into a tube that connects to the bottom of the mouth, so that anything that comes from the mouth, anything food or water or saliva, your stomach. So I tell patients we do this surgery for 4 reasons. Number 1, cancer cure. Laryngectomy remains the gold standard for cure for larynx cancer. It's used when radiation fails, it's used when the tumor is too big. We've been doing this surgery for about 140 years. It's well established as a great cure. Number 2, breathing outcomes. By transecting the windpipe and slit throat of the neck, you will never be in a situation again like you were yesterday. It's a huge opening, huge hole. You'll never be suffocating or asphyxiating. Okay? More importantly, knowing how large this tumor is, right? If you were to radiate the tumor without surgery, everywhere the tumor is located will just turn to scar. The windpipe will not open back up, which means you'll have this trach forever, which is not a great opening. It's messy, it makes mucus, it's uncomfortable. Number 2, so that's number 1, cancer cure. Number 2, breathing. Number 3, swallowing. One thing that I noticed during your operation yesterday is, while yes, this tumor is involving the voice box, which is the front half of the funnel, it's now starting to encroach on the back half of the funnel, the swallowing portion of the throat. That means the swallowing portion needs to be treated. You treat that with radiation, swallowing is going to be severely impacted. Right? We've already seen in our literature and our studies, patients who have a laryngectomy before radiation will actually have a much better swallowing outcome than those who had radiation alone or those who had surgery after radiation. And in fact, the goal of the surgery is to get you eating completely normal again. Usually patients begin eating about a week after the surgery and usually back to a regular diet within 2 weeks. When I mean regular, I mean literally anything you want. Why it's so safe? Well, the only place the mouth goes is to the stomach. It cannot go into your lungs. You cannot get pneumonia. It can't choke you or anything like that. So swallowing outcomes we see are superior. Lastly, speech rehabilitation. Were you to get radiation chemotherapy without surgery, your voice will never be any better than it was yesterday. With surgery, we can actually place a voice prosthesis, which is usually done few months after treatment is completed. As an outpatient procedure, we can place a voice prosthesis, which allows you to speak again. A voice prosthesis is a one-way valve that's inserted between the wall of the windpipe and the esophagus. So when you cover your hole and block the airflow from coming out, you can shunt the air into your throat that we've constructed. It vibrates the tissues and it creates a voice. Now, it's not the voice that God gave you, but it is a voice. It's more natural. It's soft tissue vibrating. You can change the volume, speak louder, speak softer, go up, go down with emotion, so you're not using that robot voice that's very hard for many people to understand. So, in fact, many of my patients who have laryngectomy, they go back to work like normal, they talk on the phone like normal, and many people who don't know you may not even know you had surgery at all, aside from the fact that sometimes you have to cover your neck to speak. Now, because of the degree of disease, we know that the tumor is extending not just into the cartilage, but through the cartilage outside of the voice box within the soft tissues of the neck. There are also lymph nodes that are harboring cancer on the right side. Radiation is absolutely necessary afterwards. And that's really to clean up what we call microscopic disease, because we know that the tumor has escaped the voice box and is traveling through the lymphatics. The decision on whether or not chemotherapy is needed is solely dependent and contingent upon the final results of your pathology. If, number 1, I fail to get it all, I can't clear the margin, that's a reason to get chemotherapy added to radiation. If there's evidence of what's called extranodal extension, or cancer bursting out of the lymph nodes, that's an indication for chemotherapy to be added to radiation. We see that patients tolerate radiation and chemotherapy much better after surgery because, everything is reconstructed, everything is fresh tissue. There's no actual tumor or big inflammatory response as a result. Now, the reason I'm talking to you today is because we just need to know how you'd like to move forward with things. There's always the possibility of trying to get this surgery done while you're in the hospital here. Now, I told your sister your surgery wouldn't be as straightforward as a smaller tumor because, as I mentioned, the swallowing portion of the throat has cancer in it. So in order to clear the margin, I will have to remove at least half of your swallowing portion of your throat. To reconstruct the throat, so we don't want to give you a tiny little straw and swallow it, and you won't eat anything meaningful. We typically reconstruct the throat using another part of the body that has never seen cancer. Most commonly, we use the skin of the thigh, harvesting it with the underlying fat and muscle. And we harvest a segment of it with the blood, the artery and vein that supplies it blood. We transplant it as a unit to the neck. We can rebuild the throat because skin is almost identical to mucous membranes. And then we can make you have a bigger throat than you would have now. Right? So food won't get stuck in there. After we reconstruct it, we then hook the artery and vein up to the arteries and veins of your neck. And that allows it to have blood flow. This thing will then integrate into your body almost like an organ transplant. Okay? And that allows us to give you a sizable throat through which you can eat. You can hold up, to eating, hold up to radiation, etc. And so anyways, should you desire having this done as soon as possible, obviously we're willing to accommodate that when we can find time in the operating room. This operation takes about 8 hours to perform under general anesthetic. After which, we can't let you eat by mouth because we've got a new suture line, fresh tissue in the throat. So we typically, while you're asleep, place a feeding tube that goes from your nose into your stomach temporarily for about a week. Once everything feels like it's healing, we test your swallow again. And as long as nothing is leaking out, we start you on a diet and remove the feeding tube. So patients usually return to an oral diet within about 7 to 8 days after the surgery is completed. Okay. Questions so far? Like I had mentioned, for you, unfortunately, we would still need to do radiation plus or minus chemotherapy. I would not be planned to start until about a month after the surgery is completed. So you have time to heal, obviously get out of here. By no means do I need an answer right now, okay? I want you to think very carefully about this. You're still stuck here for a few more days, and honestly, we can let you go home and come back and plan this electively. After an emergency tracheostomy, our preference is to try to do it as soon as possible, mostly just because when you disturb a tumor, it's a little unpredictable what its behavior might be. So I always reserve patients the right, if they want to do it before they get out of here, I'll make all the efforts to do so as timely as possible. Okay? I did review your swallow tests today. Looked okay to me, so if you want to eat regular food, whatever you can tolerate, we'll get you a regular diet here. Obviously, the one thing to look out for is if food's coming out your tracheostomy tube, that means it's going down the wrong pipe. Although your voice box is so tight, I don't think anything can slip down. So if it's not hurting you too much, I'm more than happy to get you a regular diet. If people want to bring you food, that should be okay. And then, just let us know how you'd like to proceed, and then we'll start making arrangements regardless of what you choose. Okay?
Now, if he has the laryngectomy, and then he'll have to recover from that, and then have radiation, maybe chemo too. Let's just say it hasn't spread anywhere else, it's just localized in his throat. And then after that, you would do the prosthesis, is that what we're
Approximately
calling?
3 months after treatment's completed, when we place the prosthesis as an outpatient, we just want all the tissues to heal so that it has the best voice outcome and the best chance of healing in place.
Okay, so ballpark timeline, like how long would that take from start to finish? Like how many months?
4.5 months from the
4.5 months. That sounds good to me. Very good, as a matter of fact. Now, during this time, what about his voice?
Yeah, so there are a couple of things you can do. Obviously, you can write. We have text-to-speech options. We will also train you with the electrolarynx. The electronic voice box that people use. There are a couple methods, and we train people both here and in my office how to use that, just to temporize you, knowing it's a temporary solution. That used to be all patients had. That was the only option before. So you've come a long way in terms of speech rehabilitation.
And I'd also love for him to see that video that you showed me yesterday.
Yeah, I'm going to write down what this thing is called, and you can just
That would
get
be
on
great.
YouTube,
If we can just
and
find
you
it,
can find
and
all people have all these testimonials and stuff like that.
yeah.
about and record themselves doing it. There's a guy who learned how to play the trombone with it. And it's pretty remarkable how normal some people are. I'll Dr. Stiller write it down for you. It's tracheoesophageal function. Okay. So obviously you're gonna be stuck with us for a few days, so think it over, talk to the family for sure. Like I said, after a few days you still haven't made up your mind. We can always send you home, do this as an outpatient. It's not ideal, but we're here for whenever you make the decision. This is not something to rush into, right? This is a pretty big decision to make. However, I do think, in my opinion, it is the best cancer outcome option and lowest chance of leaving residual cancer behind. Okay?
And if he didn't have the surgery, what would his life be like?
Yeah, so if you didn't have the surgery, then the other option is radiation chemotherapy, which can still be done, right? I would say that the chances of it curing you are less than the surgery followed by radiation, but it's still possible. As I mentioned, I highly doubt that trach would ever be removed, and I have great concerns that your swallow function may not return. And so what we then see is people become dependent upon a feeding tube and a trach, which you can function like that. It's just not a very good quality of life.
Right.
Because the reality is with this, I mean, your heart's fine, your lungs fine, your brain's fine, your arms and your legs are fine. So yeah, the rest of the bodily functions are totally normal, right? So we're talking about these human abilities that are very unique to the human experience that clearly have a big impact on the quality of life, but not necessarily duration of life, right? So that's kind of splitting hairs, but that's kind of how we think about trying to treat this problem. Okay?
Yeah, and I think Randy is a scarf guy. I think he'd look good with a little wrap around his neck.
Yeah.
He can pull it off.
And I know the speech pathologists have met with you all and kind of talked about this stuff, and so, yeah. We'll take our time, we'll figure it out. In the meantime, I'm going to still start looking for surgery time for you if you're interested, because the earlier I can pin that down, the more practical it becomes for everybody. We'll go from there. Okay? Now, response. I'm glad you're feeling better. You look great.